More and more people are starting to use compound medicine to get the medication they need. And Dr. Tennille Davis of Civic Center Pharmacy is here to tell us about why this is so important, especially right now. You just came back from D.C.
I did. I was in Washington, D.C. last week for Compounders on Capitol Hill.
Yeah.
And it's where compounding pharmacists from all over the country go to Washington, D.C. and have meetings. They used to be in person. This year was a little bit of a mixture of in-person and virtual meetings, talking about the importance of compounding pharmacy and how important it is to patients. So we had meetings with our legislators, Mark Kelly, Kristen Sinema, Greg Stanton, David Schweikert. So it was really great to be able to educate those offices about compounding pharmacy.
Yeah, because people have to realize, like, we have medicine that people take, through aspirin pills and stuff like that, but there's a majority of people that can't do that. It's very interesting that there are people that cannot swallow pills for the life of them, and they need that, but they can eat everything else and do things, but when it comes to pills, for some reason they can't, and that's where you guys come in, which is so important.
We make lots of different options for patients that have difficulty with conventional medications. So some patients can't swallow pills, some patients are allergic to a dye or a filler, and then some patients need dosage forms or doses that aren't commercially available.
Yeah.
In that case, doctors can write prescriptions for compounded products. One of the most common medications that we compound at my pharmacy is what's called bioidentical hormone replacement therapy. So if a patient tries and fails conventional hormone replacement therapy as they're going through perimenopause or menopause, they can, if they fail conventional therapy, there's a lot of compounded options. So I brought a couple kind of different dosage forms for us to look at. So these are lozenges and these are troches. What those are is they're a sublingual dosage form. So the patient puts it in their cheek or under their tongue, and it's absorbed through the skin in their mouth into their bloodstream.
Yeah.
And we can put estrogen, testosterone, progesterone, a bunch of different hormones in these kind of things.
And the reason why is that maybe because what they are being prescribed might have something that kind of like affects their body, and that's why they're not being able to do what they like to do with them, and so that's where they come to you.
Absolutely. So we make lots of sublingual or under the tongue dosage forms. We make creams that hormones are actually absorbed really well through your skin into your bloodstream. So we can make testosterone or estrogen creams. We make vaginal preparations for atrophy and dryness. So lots and lots of different options for that. Right now, talking about bioidentical hormones is a really important topic for compounding pharmacists and our patients because the FDA is looking to restrict compounding pharmacies' ability to compound these hormone medications. So we really need to get that story out so patients can start to speak up for what they need.
And that's where they come talk to you and get educated, and that's what you want people to do. You want people to come and sit and talk to you so they can help you with this small fight that you're trying to get across to, again, the FDA and everything about how this can help people, which is so important. So we're looking at all the different ones here. I know you talked about the cream, and then here are just kind of other areas that they can get the compound, right?
Oh yeah, so creams, troches, lozenges. This is a lollipop. I don't do many hormones in lollipops, but we have lots of different options, dosage forms. That over there is a insufflator, so a powder ear medication.
Wow. So this is amazing. I just didn't know all this when it came to compound. I know you've been here before with me, and we've talked about, people who needed to, break it up for the medicine for their kids or for their pets and different things, because you also work with them for pets too, which is so amazing. But this other way is so amazing. I wouldn't think about the lodges here, as you said, that goes right in the cheek and releases into your system.
And then, we sweeten them with stevia. We can flavor them lots of different ways. So what I am asking patients to do now, especially patients that use bioidentical hormones, is to go to Compounding.com. It's a really easy website to remember. And on Compounding.com, you can learn about the fight to protect bioidentical hormones. There's patient stories that they can upload themselves or read other patients' testimonials. It has a way for them to contact their state representative to submit comments to them regarding how much the bioidentical hormones have helped them. So it's a really great place. I'd love to direct people to Compounding.com. They can also access information from our website, which is civiccenterpharmacy.com.
There you go. And I know they have a great video there. It's about a 30-second, 60-minute video that you can go go take a look at and see, to learn about all this, which is so important. So they do it. Again, tell them the websites for everybody to go to.
Sure. So Compounding.com is the one to learn about the fight to protect bioidentical hormones, submit stories, and contact your state representatives. And then CivicCenterPharmacy.com is our website to learn about my pharmacy, what we do, our hours and locations, and what states we ship to. So
it's awesome.
Yeah.
Thank you, doctor.
Thanks so much for having me.
Thanks for educating us. That's so important. So, all right, come on.